So thank you, Uda. I will start, and with Fry, we will try to make a discussion between us to try to explain and to discuss on several topics on the use of digital communication in oral public health. We will try also to give you some examples, some success and some unsuccess, of course, from Europe, France, but not only, to show that digital communication could be used in different contexts. We will try to make some maybe 30 or 40 minutes to have time after to discuss between each other and to answer to some of your questions. You can have the agenda of the presentation, and let's start with some context. I'm sure that all of you already knows a lot about the WHO context, but maybe not this sentence that have been said by the previous director of digital health from WHO. And I think it's very important to don't forget that the use of digital health should be safe, sustainable, and leave no one behind, as you know, as WHO always mentioned. Because digital could be see or understand as a too innovative tool, but we don't have to forget that at the beginning it's to help everybody on Earth, or we could try to make it. Next slide, please, Fry. I won't speak about all the important and high-level documents that you all know, I'm sure, from WHO. Since 2022, we have the global strategy, but in every document that we will see during this short part of the context, digital health have been integrated. Not at the most important part, of course, and it's understandable, but every time in every high-level document or high-level strategy from WHO, digital, it's identified as a tool. It's also the case in the global oral health status that we have a specific paragraph. Every time it's identified that digital health could be a good tool to increase and improve oral health. And even in the global strategy that I hope that all of you understand, even if there is not a specific target or specific indicators, you can see in the next slide that you can find and you could use for every group or every action, integrate the use of digital technology. And even in the Global Oral Health Summit, in the next slide, some of you were there. If you want to make a game, please try to find Uda, Paula, and myself in the big picture. It could be difficult. That's why I put us in a bigger picture. But even in this Bangkok Declaration, there is a small part of the digital technology, but it's really identified that it should be used in practice, research, and of course to improve and develop preventive intervention. This is for the context. Let's see now how digital technology could be used.
Yes, thank you, Nicolas. So first, just to set the scene from that perspective as well, like why digital communication matters in oral health. And the reason we're talking about communication is because that's the area of specialty that I have. And taken directly from the Amoral document by the WHO, mobile technologies provide a new paradigm of care, particularly for vulnerable groups and low resource settings. And this is key, and this will be a little bit thread throughout everything, but just a few statistics here. 3.5 billion people are affected by oral disease, 2.3 billion with untreated caries, and 530 million children affected. As in, there is a huge audience that really needs to be reached. I think that's the key point here. And digital is, it doesn't have to be all digital, but digital is how the world is right now. An example, yesterday I'm based in Madrid, and yesterday the electricity went off and everything went off. So there was no coverage, no nothing. What do? It's so connected. That's how you feel it. But Nicola, if you want to give it a little bit more context.
Yes, I've mentioned by Frey, you all know the numbers, the figures on the need of oral health and the big issue. And WHO understand that since a long time ago, now more or less 10 years, and they start to work with ITU, which is the International Telecommunication Union, and WHO and ITU develop and implement the BLC, Be Mobile initiative, because it's identified also there is 7 billion of mobile phone on Earth. And so we know that we are not able to get access, all of us on the planet, to clean water or even electricity, even in Spain, in Portugal yesterday, for example, but in some countries it's every day. But we are all able to receive an SMS, or we are all reachable by an SMS. That's why WHO launched 10 years ago this BLCB mobile, starting by diabetes to fight against the diabetes, but also tobacco cessation, cervical cancer, and some other. And 2 or 3 years ago now, for the next slide, WHO launched the Oral Health Program. I hope that at least all of you heard about this program, and you can find this mobile technology for oral health and implementation guide on the WHO website. And this program have been done to help the countries and member states, or even implementers or ministry or any people who want to implement digital program for oral health, to make it easier. And they develop 4 modules. The first one is to increase oral health literacy of target population, but not only, using digital technology, and we will be more focusing on this module during this presentation about the communication and how to increase literacy. But this Oral Health program is also proposing some use of digital technology to improve the knowledge and skills of frontline health worker. I'm sure even we are not coming from the same country in this afternoon or this evening, we all have the same issue. Our colleagues from other health profession don't work so much and don't know so much about oral health. And we need to improve them, and we need to train them. And digital technology, of course, could be a good tool to make this work. The third one, it's something that I work a lot, and I already made a webinar a few years ago now on the use of teledentistry, and with the definition of teledentistry like medical activity. I made a difference between the use of digital technology to on training or something. That teledentistry, I define that it has been done in the MRLF program at the use of digital technology to make some diagnosis, prescription, or advice remotely. And the last module, the fourth, from the Oral Health program, it's about surveillance and how digital technology could be used to improve or to make it more easy to make some surveillance at national level. So these 4 modules have been developed, implemented in some country, and in Montpellier we start to make it with the WHO methodology, and I will be happy to give you some example and some advice and some tips and some some unsuccess that we could add during this implementation. But let's discuss about the theoretical aspect of the use of digital technology.
Yeah, so we're going to go into some of the basics here, and then it will all be framed together. But I want to discuss a little bit why knowing your audience matters. Because effective communication starts with understanding who you're talking about or talking to. Because if you talk to everyone, you reach no one. That is, if you don't have a message that is targeted to a specific audience, the message might get lost. So we have everyone, the general population, and then we try to build segments. And I remember once when I was doing my master's many years ago, the guy who was teaching market research, he said, "Why do we segment?" And I said, "I don't know." Because it's easier, and it's basic. So once you have segmented your audience, you know who your targets are and how to reach them. And Segmentation means breaking it into segments that are similar in any trait. And today people tend to use also personas to try to decide like this person is an athlete doing this, this is how his lifestyle is, and that's how I reach them. But in basic terms, your segment could be parents of toddlers. Their characteristics could be they don't have a lot of time, they're safety focused, they use Facebook, WhatsApp, and the best channels to reach them might be short videos, SMS, Facebook posts, etc. For teens, very different. They're more peer-driven, skeptical of authority, use TikTok, YouTube, etc. Best to reach them, reels, memes, or influencers. Older adults, health conscious but tech vary, SMS, TV, print, trusted sources. They're more skeptical about these new age gadgets, so they still have to be reached. So where to reach them? Choosing the right channel is essential. And it depends on who you're talking to and what access you already have. And later we'll get onto it, but this is a very key area. What access do you already have? This is going to be very key for this conversation. So please make a note of it. But as we discussed, older adults might want something familiar, low tech or lower tech. And I found it very curious a few years ago. This is actually probably 7 or 8 years ago, when they were talking about India and the use of the internet in India, which is obviously a huge marketplace, and very, very high proportion of people did have access to the internet, but they did not have a computer. They all used their phone, and WhatsApp was more used than anything else, like more than actually texting or anything, because they had to pay for it. So WhatsApp was huge, absolutely huge. So it's about like identifying these kind of peculiarities in your own neighborhood or area to decide how best to reach people. The parents of toddlers, as we said, they are on the go. They are in a rush. They trust community messages. They might be in a Facebook group or a WhatsApp group or whatever. And then the teens and young adults, a little bit harder to influence, but you could like they are driven by their peers, influencers, etc. And here's another quote from the Moral Health Handbook. Text messaging is well suited for public health interventions due to its low cost, vast reach, and ability to be tailored and personalized. So just because it's SMS, there is still the personalization part that is left to do. And we'll go into that a little bit later. So if Nicola, if you want to take this a little bit forward.
Yes, exactly. Let's discuss about SMSs because, as I told you before, in the BLC Be Mobile initiative, they start using SMSs. It may be, you could say that it's something that is not relevant or is not the best way to reach some target population. And of course, and Frey already mentioned that, could be used for everybody, but at least SMS globally could reach everybody. In the literature, we can find the use of SMS. It's already or have been validated to make a good change behavior on different kind of NCD or risk factors and so on. Of course, there is a lot of literature, and almost every day there is a new study, a new trail, a new article, a new chapter mentioning the use of digital technology to increase or improve NCDs and to fight against NCD. I will use a few minutes also to make a big hi to my colleague from Egypt with the Professor Maha Tantawi from the University of Alexandria. We are working together, and especially from the University of Alexandria with the support of the Borough Foundation, to identify and to make a big scoping review on to identify the use of digital technology at population level in low and middle income countries, because a lot of good expertise and good experience have not been published on the scientific document or scientific articles. That's why even we already have some review and some evaluation of some literatures, it's important also to find and to push the people who are using this digital technology to publish. Even it's not in a scientific article or high-level scientific article, the expertise and experience, it's always interesting to have and to know. So please, if some of you also have some experience or expertise on trail, or do you used digital technology, please make some noise to let us know how it could be used. To get back on the use of the SMS, WHO proposed to send 4 SMS per week for 3 weeks during 3 times a year. It means that they identify that if we want to have some impact and to be able to change some behaviors, is not one SMS that you will launch like this, that you will send like this, but it will a campaign of SMSs. And also because some of you know that when you send an SMS, a regular SMS, it's only 160, I think 162 characters with spaces. It's difficult to make a very big and comprehensive and global message. That's why you should use several SMS and send it in the good period of time every day for four times a week and so on. Let's try some example. Let's show now some example. One of them is from France, from the program I'm leading in Montpellier called the Montpellier Santé Orale. And we just make a very small study. I just give you some ideas, and maybe you already do something like that in your country. So it just to give you some example, it's not the perfect way to make it. To see, this study is part of a master thesis of a student in health, in political science, sorry. And we want to identify how the public sector or the city of Montpellier could be involved in preventive intervention using digital technology. So in a medical center, in a working class neighborhood of Montpellier, we reach 60 people. I know it's not so much, but at least it's something. We would really want to try something for like a pilot. We all assess the oral health literacy using some validated questionnaire, of course. And of course, we get also some data from name, age, education level, and so on. After to respond and to make the oral health literacy assessment, they choose randomly if they will be in the arm A, B, or C. And as you can see, in each arm, they don't receive any intervention. Or in the arm B, they receive some generic SMSs. It means that everybody receives the same SMSs. As I told you before, 4 SMSs by week during 3 weeks. We don't make it 3 times a year because we don't have time. We just want to test that. And in the last arm, we use all the data we get from the oral health literacy assessments. So the name, the age, the education, the knowledge they already have on oral health and so on, to make some personalized SMSs. It means that some of them receive some SMS using some very high-level vocabulary because they are well educated and they are from the previous generation maybe. And for the youngest one, because we don't have any, we have a lot of difference during the age, we use more a young vocabulary. I don't know how to say it in English, but you can understand that we adapt. Even the content was the content. The sense of the message that we want to give was the same about oral cancer, for example, but we change the form. And so we don't speak exactly the same way to a young one, to an older one. And we personalize this stuff. We are just trying to make it after 1 month and a half, a new assessment, of course, and also to organize some semi-directive interviews. Unfortunately, we don't have the final results of this study because it will be done in next month. But we already know from the first interviews that we get that the people, because it was a question that we had, what were not so upset, or they like to have a specific SMS, even they don't know that it was specific, but because we were using their name, we were using some specific vocabulary, or we use their the position they have in any company or something, they liked it, what they mentioned. So it's something that it could be used, but will be more also about the use of AI and so on to personalize some content of preventive intervention in using digital health. Sorry. Other example, in another context, I especially use another context, not in Europe, even not in the countries who are connected, because I saw some colleagues from Iran and so on who are not directly in EU region and so on, but from Senegal, also because it was the first BLC B-Mobile example made by WHO. Even it was on diabetes, it's a good success story with the Ministry of Health of Senegal and also the National Association of Diabetic People. We will see after, sometimes it's difficult to reach the people we want to target because us as dentists or even academic, it could be difficult for us to identify and to be able to reach the people we are targeting. And so in Senegal, first they make a big campaign to advertise that they will receive SMSs and so on and so on. And they can check and evaluate on a high-level survey that the people who receive SMSs improve their glycemia during this use, during the year that they have been followed. Other example, because of course, SMSs are not the only way to reach target population, and especially the youngest, or even our own generation. We all use more or less social media. It could be TikTok, Facebook, X, LinkedIn, and so on. So of course, it's also a good tool that should be used. I know that a lot of you already use that on the personal use. I saw some accounts from colleagues from all over the Europe or all over the world sharing some messages and so on. Or some of you create some specific pages like we do in Montpellier, but I know there is some other example to use some quiz, some question about it, and we could also use some short video. It's in French, this one and so on, but it's just an example. And it's important, and Frey will discuss about that in another example, in another context, in another region of the world, in Indonesia, sorry, that of course the content should be adapted on the context, on the culture, on the philosophy, more or less, of the country. Other example that we have in France, in Montpellier, and it could be also a good opportunity to try to think differently, based on some good expertise that they can find in other country, we create some preventive fiction. If you want, you can download and use the QR code to reach the YouTube channel. And normally now it's translated with subtitle in English, but we create like a small movie. It's only 9 minutes, but to be honest, it's already expensive enough to create this kind of thing. The idea is not to make some messages like face-to-face discussion with a doctor or someone give some advice, but like a movie. It's a family who wake up and they all have some issue. One had oral cancer, another one had sleeping apnea, and so on and so on. And they discuss like a family can do in every morning. So just some other example to show that digital technology also could be used differently in different way to increase oral health literacy. And the last example for this part would be once again from Thailand, from Indonesia, sorry. But it's just to give an example. I know that some colleagues from other country, from Egypt, for example, will also work on create some videos to better explain the use of any preventive intervention. This videos has been done during the pandemic, but once again, it's just an example how we could use digital technology to reach a specific target population. But to make it properly, there is some regulation.
Absolutely, and that's going to be the next thing I want to discuss, because what is the advantage that public health has? It has trust and it has data. Of course, we are in a very sensitive area here, so I would obviously advise huge precaution, because data is gold now, and as we have seen with how data is managed in Europe in particular, through the GDPR, has become quite strict. But the fact is that the public health has access to data that enables better targeting. But and this is a problem. It must be used both ethically and transparently. I don't want to say it's even a problem, but it's something that you always have to keep in mind. Because public health professionals with their databases can segment by age, health status, location. A lot of times these are sensitive categories. They can send SMSs, emails, or even letters via post directly to the people. They can identify high-risk groups by their profile, but they must always comply with GDPR and national laws, ensure consent, transparency, and data minimization, so only use what you must, and avoid assumptions or discriminatory profiling. It can be very tricky, and this is something that needs to be very, very well constructed from a data management perspective. But it is really gold, because if your important message is supposed to reach people, you have what you need to really reach them in a personalized way and in a relevant way. So it is something that, the companies that are fighting against the same message, who are basically trying to dilute the whole information, they would absolutely kill for this information. This would be gold to them. So it is gold to you as well. It's even more than gold. So this is more than anything to highlight the value of data and the data that you have. And I know it's being used very carefully in general in the health environment and medical setting, of course, for normal reasons. But what you can use it for, especially in public health, is very relevant for communication. And with that, Nicola.
Yes, and also, as you may know, some of you, well, as a French, I like to play with the rules because we don't always like to be strict to the rules and so on. But also, I made some study, and I have a master degree and a PhD in law, in health law. So, of course, it's important for me to respect the rules, and especially when I use some digital technology, because it's very important. Of course, as Fry mentioned, it's protected, is regulated with European or national or regional regulation. It's difficult to use some personal data, but it's not impossible. You don't have to think directly that I cannot use digital technology, or I cannot use, I'm not able to send email, SMSs, because it's not possible, or there is some restriction and so on. There is always a way to make it. So that's why I just want to mention that don't be afraid to find a solution. Try, discuss with the people who are expert in your country, what you can do, what you cannot do. We receive, I think, every day some SMS, some email that we don't want to receive, which is also an issue, because if the SMS or the email or the content on the social media that you want to share with the people to increase oral health literacy, or to make some oral health promotion, could be put on the same part of the messages. But the two keywords, very important, it's what Frey mentioned, it's information and consent. So if the target population accepts to receive some information, and you will see, and we will how it could be possible at the big level, not only on one-on-one or on one personal level. If they understand why you will use their personal data, and that they accept to receive any information and so on, you can do more or less what you want, only what you propose and what you say that you are going to do, of course. To give you once again an example, I told you that in Montpellier we developed this program. And this program is led by the 7 public institutions. But of course, it was important for us when we start to put all these people around the table, which are the university hospital, the city, the metropole, which is the big city of Montpellier with all the small city around, the assurance maladie, which is the public health insurance, the regional public health agency, and the political region. We also choose specifically these people because, for example, the city of Montpellier gets all the phone numbers of the people who are registered in some services. For example, for the elderly people, all the people who are in the Club d'Âge d'Or in French, the seniors club, they accept to receive some information from the city of Montpellier on, for example, potential heat or potential a lot of rain or something like that. So we are allowed to use these phone numbers, this email address, to send them some preventive information. It's the same with public insurance. We also have a lot of data and so on. But exactly some tips also. It's from the analysis of the GDPR, but also from the national health. We are able to use this data, this personal data, this phone numbers, this account of social media and so on, because we are not giving some commercial messages. If I mention in the SMS that we send, if it's brush your teeth, you should brush your teeth, sorry, it's okay. But if I mention that you should brush your teeth with the specific brand of toothpaste, it's not allowed, or it could be possible, but the person, the people, should accept to receive this kind of commercial content. So because we don't send this kind of specific commercial comment, we are able to use this data recorded and registered by some other institution, public institution. The only task that we have to do is that everybody who receive this message should be able to be unscribed. It means that because once again we are not commercial messages, we are not we are not mandatory to send stop to the XXXX to make an answer to be unscribed, but they should find somewhere. It could be on the website, it could be just to send an email to someone, but they receive the information before they receive the SMSs, of course. They have to be able to unscribe, and we don't have to integrate some thing stop that we can find sometime in the SMS that you receive. Let's start now some more theoretical aspect, and we will be back with some examples.
Yeah, and now I wanted to discuss a little bit the actual messaging. What are you going to say? And every message should be built with a purpose. What do you want your audience to feel, know, or do? And this is very key because you always have to have a purpose. You have to have an objective with why are you sending it? Because if you do send irrelevant messages as well, they are first of all not going to be read, and second, they are going to be ignored or unsubscribed very quickly. So it's to basically maximize the opportunity. And first of all, know what do you want them to know? What's the key takeaway here? And what do you want them to feel? What emotions or motivations should it evoke? And finally, do. What specific action do you want them to take? Do you want them to brush your teeth or brush their teeth rather? It's something to define. And I have to make this a little bit simpler. I want to introduce a framework. It's very simple. It's very nice and very simple. And for that reason, I want to introduce it here. So first of all, you have an idea. You know what you're going to say. The frameworks help you generate a clear and targeted communication. And the one I'm going to show you is Laswell's model. This is not new, just so you know. This is from 1948, I believe. So it's not new, but it stands the test of time. And that's not because it's digital specific or anything like that. It's more to help you figure out how to construct a logical and convincing thread of messaging. It starts with the who. Who is saying what? And in this case, let's say the public health authority. Who says what? And the message is brush twice a day with fluoride. In which channel? Where are you going to reach them? And this could be SMS, this could be Facebook. And who are you talking to? The target audience, parents with children, etc. And what is the outcome? What is the effect that you want to generate here? And we use this, for example, in JA Prevent NCD, and we encourage the use because our communication structure is very big with 26 countries and with a lot of partners and a lot of work packages. This helps find a way to generate consistent messaging, to help people think, who am I talking to and what do I want them to do? Like, what is the impact or effect that I'm trying to produce with what I'm going to do? And then you can evaluate on each step. But I'm talking here with on Facebook, but I'm talking to people who are not on Facebook. Already you see that the logical thread is not there. Your message won't work because you're on the wrong platform or you're saying the wrong thing, etc. So this kind of framework can really help you make a message that is logical and is impactful for what you're trying to do. Very, very simple model, but very, very powerful. And in terms of the effect, this is something that is always important. What are you trying to do and how are you going to measure it? And measuring is something that where digital has always had a huge advantage because you can measure quite a lot. You can see how many have visited the page that you want them to read, how many people have signed up for stuff. You can track basically the action that you want the people to take on your website. And the thing is, you can't manage what you don't measure. So even simple measures can really help you tell you if the message is working or not. And it's very important ahead of time to think about what is it that you want to do. What is the action that you want them to take? Do you want them to be aware of something? For example, if you are trying to come out with a message to correct a common misunderstanding or fake news or whatever, attitudes, this could be social media sentiments, comments, survey responses, etc. Behaviors, do you want them to start brushing their teeth twice a day, brush their children, whatever that would be? Engagement, do you want them to actually engage with your content, help spread it, reply to it, engage in the conversation? Are you asking for advice? All these things can really help you inform what it is that you're trying to do. And there are two ways to do this. You can do it through organic communication, which is basically free communication, usually on your own channels. So that could be on your website, blog, social media posts, SMS reminders, newsletters, word of mouth, schools, health centers. It's basically your own assets. And then paid communication would be, for example, Facebook, Instagram, YouTube, Google search, all very, very big and powerful companies these days, TikTok, or sponsored posts. So depending a little bit on what your objective is. And this is usually a challenge in public health. And on my next slide, I want to highlight a couple of challenges that are very big. First of all, fake news and misinformation. Fluoride is toxic. Natural toothpaste is safer than fluoride. Viral myths spread fast on social media. This is very true. And it's isolated because everyone's Instagram or everyone's Facebook is their own personalized profile. So once you start engaging with content that is fake, it can lead you to more and more. And they're quite lax, to be honest, on these kind of messages, all these social media platforms. So very often this kind of goes unnoticed, or at least not acted upon by the platforms. So it's something that you have probably all heard or seen yourself, that people are asking these type of questions because they do spread quite fast. And the other one is commercial influence, because the commercial actors have a lot of money, have a lot of budgets, and they can really buy their space. And of course, that is problematic because a huge part of the commercial influence is focused on cosmetic dentistry. And then the aggressive ads for teeth whitening, implants, etc., that maybe you have seen yourselves. There are always new products that offer some incredible solutions to these kind of problems. And really evidence-based care is drowned out by this kind of messaging. This is a loud voice. This is, if you live on social media, like many young people do these days, this is a message that you're seeing. They might not be seeing anything from oral public health, except when they actually go for a checkup or something, you know. So it's very, very hard to fight against these influences. And why is this important? Because there are consequences for health. If you are, it's simply confusing. It's confusing because people, they believe it if they read it often enough, or if they hear the same message. So it's very problematic. And in terms of literacy, that's such a great point. Like, if you do not know what is right, then you believe what you see, and that is very problematic. So you read the fake things, and this is very, very much highlighted in the Moral Health handbook as well. The exposure to fake news can mislead people into decisions with negative health impacts. So not only are they not improving their own health, but they're actually making it worse by doing certain things that might be suggested, inaction, etc. So it's a complicated landscape. And in terms of the emerging tools, AI, that's the hot thing right now. And AI is obviously has changed the world. It's been a technological revolution, and it only happened a couple of years ago, a year plus. So it's not like something that people have been using. But when I say AI like that, I'm talking more about the models that are available to the general public, because AI is something that has been used for a very long time, and the algorithms behind it, you know, it's like the GPS. The way they find their targets, it's like gradient descent, something like that. So it's a formula that basically finds you and boop, and it pinpoints you. In the same way, like this kind of machine learning and now these large language models have become amazing. They can really improve productivity, etc. But in terms of what they can do for communication, they can really help you personalize messaging. And as always, like, if you are just going to ask AI to do everything for you, it's probably not going to be the best outcome. But it can really help you. It can make you more efficient, more productive, and it can help you validate information, etc. So in terms of typical use cases, you could say personalized messages based on audience data, generate and translate content. That's something that has improved a lot. It's still not perfect, so I would always take it with caution. Like for myself in my native Icelandic, I always have doubts. It's of course a very complicated language, and very small language. But if I would not read over it, people would simply laugh because it's so not accurate. It can help you detect misinformation trends. That's quite useful, because you can actually see, like, these kind of things, like fluoride causes harm or cancer. Don't use fluoride toothpaste. Use whatever, bamboo oil toothpaste. I don't know what's you know, what people are using these days. And then analyze engagement. You know, what kind of content works. It can really help you. It can save you a lot of effort by using it, because it is extremely powerful. And just in terms of a few examples, like the AI generated messages in France outperform generic ones in effectiveness. Why? Because if you are going to go alone and you're going to do all these things, it's going to take you a lot of time. If you do use this kind of help, and you see like how you can personalize it based on certain variables, it can really help you make it more targeted. Multilingual campaigns, as I said, use with caution, because it's not always perfect. And the real-time myth detection is something that is very, very interesting, and something that Nicola will discuss in a little bit as well. And then A/B testing. A/B testing is something quite common in digital in general, where you can actually have a different versions and then you can just test it out. So a lot of use cases. This is only the top of the iceberg. Basically, there are so many useful ways to use AI. I would always repeat the same point about GDPR and sensitiveness of data. But it is a tool that can really help you become very, very productive and efficient. And Nicola, on that part, maybe you want to discuss a little bit on AI.
Yes, exactly. And as mentioned, Huda, just for introduce ourselves, Fry and myself, we are all working on the Joint Action Prevent NCD. And this Joint Action Prevent NCD, France and Greece are working together, and I make also the opportunity to give a big hi to Maria Tanzidou, who is involved in this pilot with me. And in this pilot, in oral health, and especially in oral health literacy, we work with a big company as IBM. You know, I'm sure all of you know this company. And we have to create two AI tools. The first one, it's to be able to scientifically and automatically validate the content of oral health promotion campaign. It means that, for example, if some of you want to make some videos, you need to have a script at the beginning, or if you want to make some post on social media or some SMSs that you want to send to everybody or to a target population, you will put this content in the AI, in the machine, and the machine will be able to tell you if all the content you are going to send, it's perfectly on the same point of view of the scientific and the gray literatures. Of course, you could say, I'm an expert and I'm able to make it on my own. I can make some literature review and so on, of course. But sometimes the people who are sending this kind of program is not, they are not exactly experts. And that's why we want to make the opportunity, especially for the implementers. For example, in France, it could be used from the public insurance, who are not always expert on some topic, to be sure that we can find a scientific article who validate what they are going to say. This is the first AI tool that we want to do. And the second one is to help implementers, like in France, regional public health agency, some hospital, and so on. We want to target a specific population on a specific disease or on a specific risk factors, on a specific context. For example, in France, in high level, high income, level, or low income, and so on. And the machine will be able to give you the perfect, or at least some example, and to let you know if you should reuse SMS, TikTok, social media, TV advertising, and so on. And also to be able to find some content already existing, or this is one of my dream, and I say dream because I will give you some other dream I have, but also because the machine will know which target which population you are targeting, on which disease and so on. They could propose, based on AI, generative AI, to give you the perfect content. Even it could be possible to have a video perfectly adapted on the good language with the good vocabulary and so on. And speaking about dreams, I have a lot, but I just give two. One, we are all from all countries. We don't speak the same language. I try to speak English, but as you can hear, it's not my native language. But I create some content in French, sorry. But everybody in France don't speak French. So it could be good to share the content that we already created in a specific database. It could be at European, or the best could be at global level. All this data or all this content have to be scientifically validated, of course, and impactful with some evaluation or assessment at least to be sure that what we create have been a good impact on the target population. And now with the AI, it's quite easy to create some translation. Of course, this translation have to be adapted. That's why I have another dream that I share with you. It's also to create some AI to be able to create a personalized prevention content. I told you that it's something that we are going to start in the pilot in the joint action, but we will also work especially on the language, because of course I can see there is some people speaking Arabic, Hungary, Belgium, and so on, Greek, and so on. But sometimes also the vocabulary is very important, and it's more difficult right now to. It's not a translation. I speak in French. I have a quite level of French, and every people who live in France don't understand when I don't perfectly understand the word I will use. So that's why we could also try to make some AI. We will be able to not translation, but adapt the vocabulary for everybody to leave no one behind. Exactly. After the dream, let's conclude with some take-home message.
Yes, just very quickly to recap on what we discussed. Very much aligned with a lot of the things in the oral handbook, which we used kind of as a backbone to the structure of this presentation. And first of all, that strategic communication matters. And I think the key term here is strategic. Plan it ahead, know what you want from it. And effective messaging starts with knowing your audience and having a clear purpose. What are you trying to achieve? And another big point, public health competes with the louder voices. There's a lot of commercial actors in oral health and in every other aspect of public health. It is a battle with commercial actors who invest heavily in paid media. And this is where it's about being smart and really utilizing what you have. Of course, with a degree of caution and knowing that you can, but it is something that is very, the trust is something that you have that they don't. And then misinformation challenges trust because they constantly spread this kind of doubts. So false claims, and they spread fast. This is what happens when things go viral. And this is a challenge because this can really undermine years of public health work and established science. And we see it in all aspects of life, with COVID, with whatever, like it's very, very broad. And then the digital tools can be allies. So don't hide away from them. Don't shy away, just have a look and see if it's something that can be useful for you. And finally, equity and clarity must guide all efforts. Very key. Communication should be accessible, culturally sensitive, and grounded in public health principles. And Nicola, for your final points as well.
Yes, just it's to follow what you mentioned. For me, if I have two things to give you from home, it's that digital technology must reduce inequalities and above all, not increase them. That's why it's very important to consider if you develop some or if you want to implement some digital program or oral health program using digital health, to think about the digital and digital health literacy, to think about the economic point of view, and if the people need to be rich to get access to the service is not so good idea, and of course about the communication network. If it's available only for people who live in the big city because you need a big Wi-Fi or a big network, is not so good. And even as you can understand, I'm a big fan of digital. I'm completely convinced that the 100% digital is not ideal. So of course, the best way it could be to have some 50-50, 70, 60-40, I don't know, but to have a good amount of digital could be used like face-to-face with a human relationship. And now I saw Uda who opened the mic or the video because we speak too much, and we are agree and open for any question and so on.
Thank you, Nicola, and for a wonderful presentation. Examples of good practice, examples from research, but also in terms of implementation. I'd like to open up the floor for questions. Do we have any questions for Nicola and Freya? I can't see anybody at the moment.
Sorry, it's Ken here. Just a couple of comments. Well, thank you for a very practical presentation. I think that's what struck me, you know, particularly tailoring your material to the audience. I think that's so important. But I have a question. There are quality guidelines for distance learning, for distance learning. Are there any quality guidelines for the area you've been talking about? Because I think it would be very helpful. Just put your practical tips with evidence to support them and actually come up with some guidelines.
So
I don't know if I'm not sure if it's a question or a comment.
It's both. Are there any guidelines? If there aren't, wouldn't it be a good idea to generate some?
Yeah, yes, I know what you mentioned about the guidelines on the best practice on the training and so on remotely. On this aspect, I think on my knowledge, but as I told before, sometimes it's very, very difficult because to find, because it's not in like PubMed or something to find some specific guideline. But even in WHO, there is not official guideline how to use digital technology to on specifically oral health. Of course, there is a lot of expertise and experience. I just discovered a new one from the chat. Let's do it, I would say. Maybe the digital and innovation subgroup of EADPH could try to work on this kind of subject at European level to try to propose a draft, because we need to challenge it to a lot of people, specifically on oral health, how to use, not perfectly, but the best way possible, digital technologies. Maybe Frey, you want to add something?
No, I wanted to say the same. I just think it's you know, we tried, and thank you for your comments. We did try exactly that. That was our objective, to make it practical, to make it clear and logical. So I'm happy if that came through. And I think this kind of, you know, best practices document or something would be a good idea, because it wouldn't have to go down to such a detailed level either. But I think you know, the devil is in the detail. But at this level, like when you're talking strategy, it can really help you guide your efforts. Even if you don't do everything yourself, you work with external partners or agencies even, you can still, you know, clarify, and you can really form the strategy yourself. So I think it's a very good point.
Thank you very much. Maria.
Hello. First of all, congratulations for your presentations and for all the energy you transmitted to us for digital health. I wonder, well, you mentioned that, okay, digital health interventions and especially MRI health targets adolescents, adults, older adults. But I wonder if somehow, I guess for practical reasons, it's not already achievable, if we could focus on young children, because according to WHO, children under 8 years old are especially benefit from health literacy campaigns. It's the early childhood effect, because their brains and their the character and their habits are under, let's say, construction. So it's what the information they receive is carved, it's rooted in their brain. So is there a chance that we could have some more, let's say, digital means targeted the young children?
Thank you, Maya, for your nice question. I was sure that you had this kind of good question, with tricky question. Of course, with the young children, it's difficult to reach them through social media, because I hope that they don't have any account at that age, or any SMSs and so on. So the example that we can find is to target their parents of course, that they will give them the information. Also, I think about when you mentioned that, an example from Australia, not on oral health, but on the skin cancer, where they integrate skin cancer promotion messages in dessin animé, in a cartoon for children. With the cartoon, it was targeted, it was created to explain to the young children why they should make some good protection when they go to the beach, when they don't have to be exposed without any shirt or something like that. So maybe it's something that we could create once again. The issue is, the idea is not to create an oral health cartoon, but to try to work on the cartoon already existing. Then they will give some information to the children, with sub messages. I don't know how to mention that, but in the subconscious, to give them some information using cartoon on the digital technology or the digital communication they use. And I think cartoon could be one example. Maybe Frey, you have another example or idea?
Yeah, I think it's a great question, and I mean, of course, the education system has to contribute somewhat to that as well. But I think what you said, like generating content, etc., is very key, because at the end of the day, the responsibility is very much on the parents during this part of life, and of course, there are peer pressure and everything, but it's very tricky through social media because of really restrictions on targeting. So what you can do is, you're not going to, also because they are underage and everything, it's kind of what has to go through the parents. And I just wanted to highlight also that what we showed in terms of segmentation, for example, that's not finite. That was just examples of maybe the broadest groups that we have. But within that, you can segment as much as your own capacity allows you. You might be able to say that people from this part of the world with this age, who does this and that, you can apply a lot of different criteria to create your target groups, within that segmentation practice. So it's not a finite list at all. It's mainly more like, how do you target it? And I think all parents want what's best for their kids. So if they understand that by doing something, they will actually set them up for life, it is something that is, that people will strive to do. So I don't have an answer for you that is a holistic, but I think this is the right way to go, like reach the parents and get them, because they can't evade responsibility.
Thank you, Freya. We've got a question from Ambrina.
Thank you. First of all, I would like to thank Daniel for organizing such a good session. And secondly, Friar and Nicholas, thank you for this lovely presentation. I have, I wanted to share some perception, the general perception that we have in usually low middle income countries, but since I come from Pakistan, so I would like to share a view that is more prevalent here. Here, most of the clinicians, but since they are very prevalent here and very few people who are working in community and public health, so it's usually their perception that whenever we are talking about digital dentistry, what pops up in their mind is about, CAD/CAM and certain screening tools which can be used virtually, or which can be used for the remote population groups to bring them into the clinics. They don't know, or they don't understand what oral health is all about. So initially, it was very difficult for me, being the community dentist, to convince them that, see, oral health is not about carrying a mobile unit to the community and serving them. It's about utilizing the mobile for this purpose, which you very explicitly explained in this your presentation. But apart from this, since we are talking about digital dentistry and its usage in the public health services, so do you have any idea, apart from oral health, is there any specific tools that you would like to tell us or give us examples that can be, integrated with oral health? Because I don't find anything going on, since you also mentioned in your, your presentation that there's very little evidence available that low middle income countries are actually practicing all these things. And we really need that, we really need that. But it's very difficult to, convince these people to utilize these kind of important tools such as oral health. So do you have any idea what other tools could be integrated with oral health? Thank you.
Thank you, Ambrina, for your question. And once again, a tricky question, but it's very challenging and interesting. Yes, of course, about the low and middle income country, digital technology could be, I think, I don't live in this kind of countries, but I try to learn more and more about that. And for the digital technology, it's a tool. And because it's a tool, it needs to be adapted on the context. That's why the idea is not to just copy paste what we can do in France to Pakistan, Saudi, because I saw Allah, Greece, and so on. Even in two low middle income countries or in two high income countries, the tool cannot be used in the same way because of culturally context, philosophic, once again, education, and so on. So, and it's difficult because there is not a magic solution which could work on everywhere for everybody. But it's something that I think it's more challenging than afraid. We don't have to be afraid of that. That's why, once again, the most difficult for us, it's to know about the good expertise. And like Ken proposed and mentioned, it's something which is quite difficult to identify the good practice and the good examples that we can find everywhere. Once again, I mentioned the scoping review that the colleague from Alexandria University are going to make, supported by a Burrow Foundation, to try to identify some good example. And they found a lot of good example. Let's see if when we will read all this content, it's good or not. Once again, I really open the mind of everybody. If us as a group, we are EADPH today, but also globally, if we can work together, high income, low income, middle income, everybody, to try to share what we are going to create. Because you will have some good ideas that I don't have in France, and reverse. I have some people in France who don't speak French, but they speak Pakistanis. And so it could be interesting for us to use the content that you could develop based on your culture, based on your context, especially, and it could be used in that way. So unfortunately, I don't answer to your question because I cannot give you specific examples what you could use. There is a lot, but there is also a few identifiable and visible. That's why I really open the mind to think about a global or at least European or EADPH data bank of content.
Thank you, Nicola. I know we're running a bit over time, but I'm going to ask Alla to come in and ask a question.
Yeah, thank you. Hello, everyone. Hello, Nicola. So this is Dr. Ala Qari. I'm chairing the teledentistry unit at Al Qura University in Mecca, in Saudi. And in our units, we are working in different projects, education, research, and all of that. One of the things that upcoming, we are working in developing competencies for teaching teledentistry, and it might also involve digital and AI. It's very interesting. Thanks for the presentation. It's very interesting to have kind of pilot that will develop kind of program based on evidence base and so on. I'd like your advice Nicola, for if we want to start kind of pilots or like including AI. You know, I have like a lot of projects in teledentistry, but specifically for AI, from where can we start like to integrate AI in kind of the projects regarding education or research, kind of community-based programs? Thank you.
Once again, it's tricky and it could be long, so I need to be quick, but Allah, of course, we can discuss about it in another time, but very quickly to try to answer. Based on the use of AI, it's very on fashion and everybody want to use it. As with my legal concern and regulation concern, I should say that data is something, but you need to be able and allowed to use the data that you want to use for the AI solution that you want to create. And if I have to be very quick, I should say, before to create a very specific, very difficult solution using AI, we should start with the basic. And I'm sure that with some good knowledge between each other, between all of us that we are today, if we share some information we already have, we could create some basic AI tool which could be very helpful for the everyday work of the public oral health professionals to improve the content of our messages, to improve our intervention, and so on. Because what I'm afraid with the use of AI, it's like I mentioned at the end of the presentation, if the tool that we are going to create with using AI, you have to pay even few dollars for each used, some people won't be able to afford. And so I think it would be, once again, to create some inequality where you don't have to have more inequality because we have already too much. So AI should be used. The most important, I think, is the aim to use AI, of course. Why we want to use AI? If something is already working well, why should we use AI? But now, I think there is several groups. I think about the one with ITU and PALC using AI for all. It's too difficult question to answer in a few minutes, but let's work together, I should say, and let's discuss and let's think together to find the use of AI in a public oral health way.
Thank you, Nicola. I think you've been fine with lots and lots of questions. So I'm just going to go to Freya for an example that you talked about, which was TikTok and adolescence. How do we ensure, it's really, really difficult, how do we ensure that the TikTok messages are evidence-based when we have no control around the misinformation, especially coming from influencers and role models that, you know, children and young people tend to be attracted to? So how do we deal with that challenge?
That's a very good question and very common, I can tell you. And there's a lot of doubts, obviously, with people even being on those platforms, you know, and I know that from my own organization. There's always this conversation, but I think the key point for me is, you know, you need to reach your audience. Your opposition is there. What do you have that they don't? You have trust. You have trust, and you have confidence, or you have the confidence of people that you are speaking the truth. In most cases, of course, as we saw with COVID, it kind of people, at least in a lot of countries, they did not believe the WHO, or they did not believe their own countries or ministers because they thought that it was all, you know, they believed influencers. It's very tricky, just to be very honest, because they do have budgets and often they are selling something. So they actually make money from either their own publicity or they're selling products that are not really very, very beneficial. So it's a very fine balance. I would say it's always a question for every single organization to evaluate how you work on TikTok, because you can have your official channel, you can do your content, and make sure you do it well and do it in line with your own standards anyway, because this is where people are anyway. But then that might not be enough, because you might actually have to work with influencers. And the problem here is and I got this question in Iceland not too long ago. Like many years ago, they did these kind of co-branding about stop smoking, and they had people who were maybe athletes or something, and then they were caught doing stuff. It's like Tiger Woods and Nike, and it's all these kind of co-branding. But when you talk about influencers, you're not just talking about co-branding, because you are actually talking about reach. So it does not mean that they have to live your lifestyle, but of course you want someone who can be trustworthy, etc. So it is tricky also because TikTok does not allow advertising in all countries. So advertising on TikTok is not allowed in Iceland, for example. So doing that organically is hard, and it requires a lot of effort and good content, etc. So I don't have a magic solution because every single case is different. You know, if you're in a certain region and you need to reach a certain audience, you have one way to do it, and then in another one it might be different. So all I would say is, you know, there is opposition to TikTok, but you have to kind of define how do you want to approach it, because your opposition is not going to go away. It's the opposite. They're probably going to be even louder and louder. And if this is the only place that the young people get information from, you're going to be left out, you know. So it's an unfortunate thing, you know. So you have to evaluate how do you reach them. And SMS, for example, is an example, but how impactful will it be? You don't know. So I wish I had the solution for you. Sorry, you're on mute now.
Are there any other additional questions? I can't see anybody's hand up. Well, I'd like to take this opportunity to thank Nicola and Freya for a wonderful presentation into digital oral public health. And thank you to everyone for attending. Enjoy the sunshine, enjoy your evening. Thank you very much. See you soon.
Thank you, everyone.